And Claire, I'm going to turn it over to you.
Thanks, Diane, for the warm introduction. I'm just going to share my slides, everybody. So as Diane said, my name's Claire. She did a really nice introduction of me, but I also want to, just introduce some of the people who came before me and helped to make this work possible. So the Frank McKenna Center at St. FX for Leadership, Research Nova Scotia, and the National Collaborative Center for Determinants of Health have all supported me along this project. I also want to acknowledge the shoulders that I stand upon from all those who have fought for racial justice before me, as well as all the brave survivors and victims of sexualized violence who have really started the conversation and made the way for this work to be done and heard. I also want to acknowledge the Mi'kmaq territory, the ancestral and unceded lands of the Mi'kmaq people, which is where this project was conducted, as well as the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral peoples, which is where I'm presenting today from. And I'm just going to go next to my slides. Yeah. So 3 kind of key issues stood out to me and kind of formed my why and why I wanted to conduct this project. There is the fact that sexualized violence rates are very high, especially on university campuses, and they have remained high over the past 20 years, coupled with the fact that racialized people are both more likely to experience violence and less likely to be able to access health services and support services. Alongside all the gaps in the literature around these 2 areas, despite kind of the way that sort of calls for further attention, at least for me. So as a racialized university student on a rural campus in Canada, who was kind of witnessing some of my peers' academic pursuits derailed by sexualized violence, I knew that once I was granted the chance to conduct a research study of my own, that I would want to look further into this and just try and represent more voices in the literature. So that kind of led us to our research question, and we decided to ask, what are the barriers and facilitators to accessing sexualized violence services for racialized students on a rural university campus in Canada? We decided to answer this question through a qualitative study with service providers in sexualized violence who have worked with racialized students in the past as kind of an initial stepping stone. We used email interviews, and we analyzed our data using a thematic analysis. So on the right here, you'll see a graphic that came through our analysis process. And it kind of starts in the center where I suggest the visualization of a box as an initial stepping stone in answering our research question. So our first theme was fitting inside the box, and that encompasses the sub-themes of existing in a white space and doing too much and not enough. So existing in a white space is about the barriers which exist for racialized students when they enter a space that is filled with white people as someone who is not white. The whiteness of service providers creates, and the absence of racialized service providers creates this white space in sexualized violence service spaces. So that is a place where problems and accessibility continue to be issues for racialized students. So the white space kind of represents the societal failures, structural discrimination, and institutional barriers that keep racialized students in that box where sexualized violence services are inaccessible. The next sub-theme is doing too much and not enough. So our service providers described how they are doing it all, but they are being spread too thin to be effective. Service providers are saying, I'm white, that's a barrier for me, and it limits how accessible my services are. And so that's not so that we're feeling sorry for them for being white, but it's just so that we're acknowledging that that is a barrier that limits the accessibility of their services, and it needs to be addressed. Service providers also understand that their services must be tailored to meet the needs of racialized students. But when you think about that, alongside the fact that they are overworked, you can see the box that they are stuck in. So our service providers are maxed out with a workload that isn't working. And there's a great quote by Albert Einstein here, doing the same thing over and over and expecting a different result is a definition of insanity. And I think that it really applies here. And I think that it kind of shows that there are cycles that we need to interrupt in order to increase the accessibility of sexualized violence services. So that brings us to our next theme, which is interrupting the cycle to open the box. And it encompasses the sub-themes of making the invisible visible and being included in the conversation. These represent strategies of disruptive innovation, which can be used to move towards increased accessibility and getting outside of that box. So making the invisible visible is about facilitating access for racialized students. We need to make power dynamics that are invisible visible. We need to make the intersections between race and sexualized violence visible. And we need to make the services themselves more visible with marketing materials. But what is most significant to me, and is represented in this quote here, is the need to make invisible attitudes held by the service providers more visible in order to interrupt them and move forward towards more accessible services. So one of our participants here shares about the difficulties in getting the average students to participate. And there is a lot of inequity in this statement, and it's important to recognize that and to recognize that it is more difficult for racialized students to be seen as above average and to be a part of that student union group that has the best access to sexualized violence services. And although that does create a lot of discomfort for the research team and maybe for some of you listeners here today, discomfort really is one of the keys in interrupting cycles and changing behaviors and moving forward. Being included in the conversation, it holds the potential to interrupt the cycle of inaccessibility and create services which are more relevant and appealing and inviting for racialized students. So one of our participants, who will go by Taylor, told us in their interview that new policies have been made which are more supportive. However, they've been made without racialized voices. And this is a problem because there is inaccessibility attached to the disconnection between racialized students and these services and these systems. So a major element to facilitate this access will be for service providers to build trust and form partnerships with racialized students. This quote here explains the disconnection between racialized students and the services, and it shows that profound isolation and why there's a need to include racialized students in the conversation. You know, they're out there and they don't feel comfortable and they need to be brought in and included in the conversation. It kind of, for me, brings new life to some of the buzzwords we see in current documents about collaboration and partnership, right? Our final theme is stretching outside the box, and it shows the long-term goals of reconceptualizing power and reimagining access. So when I talk about reconceptualizing power, I'm not talking about more power. I'm talking about reimagining power and reconceptualizing it as different things: positive power, power as self-determination, power that is affirming and empowering. And I think that it really does hold the potential to create services that are more accessible for racialized students. And Casey here does identify self-determination and survivor-centric services as the most important thing to work on in developing more accessible services for racialized students. And a lot of that also really echoes some of the works of bell hooks that did kind of inform this project. Our final sub-theme is reimagining access, and this centers on two elements of access. There's one that's getting the racialized students into the room, and the other one which is meeting them where they are. So getting them into the room is about co-facilitating, working with trusted community members, breaking up that white space with more diverse service providers, and making, services that are more culturally relevant, that are more context specific, and that are more inviting and appealing for racialized students. And then the other side of that is about meeting them where they are and kind of getting that access on the second side of that two-way street, about getting consent, about consultation, about making sure that it's the services that are changing and not the students that are being asked to change. So service providers are reimagining access and stress the significance of building trust, getting consent, gathering permission, and being visible to the entire community. And it's really important for us to be able to actually meet students where they are. So although we had a lot of interesting findings that presented a lot of unique considerations for moving forward, there are very importantly more voices to include and aspects of the findings that need to be explored more in future work. But some of our implications for practice are the need for service providers to share the facilitating space with leaders in racialized communities, and the idea that service providers should take the lead in building connections with racialized students to form those trusting partnerships and collaborative relationships. there were also significant implications for education. The first being new professional development programs that support service providers in becoming an effective ally and an advocate, aiding them to reflect on their own unconscious bias and learn about intersections between race and sexualized violence, as well as skills seminars on how to take these ideas that they express in their interviews and translate them to practice and help them to be implemented to improve the access for the people that they are serving with their skills. Importantly, there are also considerations and implications for policy. It will require shifts in funding and staffing to support service providers in taking on these additional responsibilities. So they have, protected time within their practice to support these sustainable changes. And then the considerations for future research are most importantly to seek the first person perspectives of racialized students, as well as to work with a larger sample size and to explore other contexts such as an urban context, because our results are really nestled within the rural context that this community that the study took place in. So I want to leave you with this final quote from one of our service providers, where Taylor says, "I don't think we've done a great job in considering the needs of racialized students in terms of reporting and disclosing sexualized violence." And in the background, I've chosen an image from the George Floyd protests, where two kids hold a sign and they remind us that the fight for racial justice is for everyone. And so it kind of brings me to my new why as a service provider now, where I'm remembering that it is very important for me to implement these strategies into my own practice and to ensure that I'm providing accessible services, and I'm reminded of the significance and the importance of applying social justice and health equity to everything that I'm doing, and kind of remind us all to look critically at our own lives and see what we can do in our part in this fight towards racial justice. Thank you so much for listening.
Thank you, Claire. Your work is really incredible, and I've heard you present it a few times, and every time I do, there's a different aspect that resonates with me. And today, as I was listening, I'm thinking about what you said about discomfort. And, so I am a white, cisgendered, heterosexual woman. So the world is pretty comfortable for me on a daily basis. And I think that, as a service provider, service providers, we tend to think that's what's comfortable to us, is therefore also and should be comfortable for people that we're providing service to. And that's obviously not the case. And so we need to be prepared to be uncomfortable and to purposely seek to be uncomfortable, because that's probably where the solution lies. I'm also thinking really strongly about what the theme around being included in the conversation. And, it's such a simple concept in many ways, right? To talk to the people that we're providing service to find out, what is it that people really need? And in what way will it make them feel safe? And in what way will it actually meet the needs that they have? And I think you mentioned there's a lot of sort of catchwords and catchphrases like collaboration and partnership. And we often also throw around the word engagement, but without really engaging. Sometimes when we say we're engaging, we're informing, we're giving information that's already predetermined, but we're not meaningfully engaging so that, services, for example, are co-designed or co-owned with the people, the communities that are part of that. So those pieces are really, really sticking with me today. So thank you very, very much for that. That's really incredible.
Thank you.